Thank you for joining us today to learn a little bit more about healthcare in the age of COVID. Today's presentation is going to focus on pediatric and primary care, and two members of Team CSV will be here to share with you their perspectives. Dr. Jennifer Chittum is a pediatric physician at Arroyo Chamizo Pediatrics, and Dr. Kristine Parke is our medical director for ambulatory services and clinical informatics. They are longstanding members of the community. They've cared for many kids in Santa Fe and northern New Mexico, so I'm sure that you'll enjoy hearing from both of them.
We mobilized from the very beginning when COVID initially started, that first case in Santa Fe on March 11th. So we created a physician team to really look at COVID every day we've met since that time to decide testing and safety measures. On the outpatient side, since I'm the medical director over all of those clinics, we've initially shut down the clinics and shut down the waiting rooms. And we mobilized an entire virtual health, which means telephone and video visits. Within 10 days, we were up and running, having never done that before. So we were able to see patients and take care of their chronic conditions, in addition to seeing them safely when they had respiratory illness and getting them tested when it was appropriate. So the ambulatory surgical world has really changed since COVID, but we've been really proud of the work we've been able to do here at CHRISTUS St. Vincent to keep people safe on a daily basis. I feel really confident that our facility and all of our ambulatory clinics are absolutely safe places to be. Absolutely, we are open for business. We are seeing patients in the clinic. Our surgeries are incredibly safe. I'm scheduling patients for knee replacements and other procedures that we had postponed for a while when we were postponing elective procedures here in the state of New Mexico. But we are opening those up and pre-testing those patients for COVID and making sure that they're healthy to show up. And the outpatient clinics are absolutely open. If folks want to stay home and do a video visit, we are ready to see you. And if you'd like to come in person, we are asking that people mask and make sure that they answer honestly and safely to all those screening questions so that we can keep people really safe at our clinics. We have same-day appointments available. We have urgent care that has availability today. We have been able to start on our MyChart capability, which is the way that you interact with our computer electronic medical record in Epic, which is the system we use here at CHRISTUS St. Vincent. You can schedule a new patient appointment and establish a patient appointment. You can even get a video visit from that website and also get a video visit on demand today if you were to go on that website. We initially had the waiting rooms entirely shut down. We are now allowing some people to wait in the waiting rooms, but we're maintaining that 6 feet of social distancing. Everyone is masked when they come into the clinic, and all associates are masked at all time. And all of our associates and our patients are screened for their temperature and asked screening questions at the initial front door before they come in. Our own associates and employees are also screened before they come in, and if anyone is experiencing any sort of illness of any of the symptoms that we see with COVID-19, we are having them call employee health and stay out of work and making sure that they are safe before they return to work. Patients didn't stop having chronic medical diseases in mid-March. We still had patients struggling with their diabetes, their heart disease, their cancer, their depression. All of these things still needed to be seen, and yet patients were scared to leave their houses, and we were under strict social quarantine from the governor's orders. And so we wanted to respect the governor's orders and keep our clinics safe, but also provide our patients with that chronic long-term care and that relationship that they've learned to rely on to keep themselves healthy. So that's why we started doing video visits And we've been able to increase our capability with that and made it easier to use on your phone. We've been finding other resources for folks who might not have access to internet. We've even had patients with respiratory illness pull up and use the internet from our clinic site while sitting in the parking lot and do a video visit from the parking lot if they did not have internet at home. So we've been creative to really look at what the patient's resources are and how does that patient continue to get access to care. I have become incredibly skilled at being able to diagnose things I would have never imagined to be able to diagnose on a video visit. Yesterday, I actually saw a patient in the clinic, because now we're seeing some patients back on site, who I had diagnosed a rotator cuff tear. And when I actually got to touch his arm and examine him in person, my same assessment was a supraspinatus tear by internet, on the video visit, and also in person yesterday. And he said, "I know, doc, you were really good." So we've looked at rashes, we've looked at all sorts of things. When a patient's had an illness that's not able to be assessed correctly on the video screen of the computer or my telephone, then we have had them come in for a visit. All patients with respiratory illness, we're having make video visits first, because we're really trying to keep everybody with respiratory illness out of the clinics if possible. And so if I see that somebody's having trouble with their breathing, or they look like they're in some distress, and you can really make a lot of assessments just by seeing someone's face, which is why we're really focusing on video visits over telephone visits, because there's a lot more personal connection with the video visit. So if I see somebody's in distress, then we've had them either go to the emergency room and call the emergency room ahead of time to let them know that they're coming, so we can really have a nice, smooth transfer over to that care, and the emergency room's waiting for that person. Or we've had them come to our clinics, and we've dressed in the appropriate protection of the masks and the face shields, gloves and gowns, and gone out to the car to check somebody's oxygen saturation and to listen to their lungs and do that kind of assessment. So we've been very creative in how we are seeing patients, but our goal is to really give patients the level of care that they need and deserve. Patients have been really grateful for being able to see us. My 98-year-old patient, who told me this was not how she saw her swan song, was having to live through a pandemic. She got on the video visit. She was very proud of herself. We had a great visit, and she actually did a follow-up video visit and 2 weeks later. So I think from all ages, we've really had incredible success and feedback. We actually started during this pandemic, letting teenagers do video visits, so that they could have some access via their phone with their parents' permission, so that they could have some privacy. We saw the no-show rate in our behavioral health clinic, who helps take care of folks with depression and other emotional illnesses. We saw the no-show rate decrease by over 40%, because patients felt comfortable getting on the visit. They didn't have to drive. They didn't have to have transportation. It's been really amazing to see how many people have engaged with the video visits from all different age spectrums, socioeconomic, any classification you could make. Patients have really been excited to participate in their healthcare in that manner. When somebody goes onto MyChart, that application either on their phone or on their computer, they see their primary care doctor or nurse practitioner on the screen, and they can see their name, or they can schedule with somebody else in that same office, and also with some of the specialists that they've seen, and they can schedule a video visit right there. There's a little video camera that you click on that says schedule a visit. Would you like a video visit? And then you can set up the time that you'd want. And then prior to that day, our staff calls the person and sends them the instruction sheet so that they really understand and they can work out any of the technological, bugs or issues that they may be having. So we have an incredible information technology staff who also will do warm handoffs to the staff. You can call them while the patient's trying to get on the video, and if they were having any difficulty, they actually will help the patient and call them to help troubleshoot and navigate. And as we've gone through this system and this whole process, those questions have gotten less and less as our staff becomes more skilled at getting people on to the video visit. We're starting a new program this week that's inside of Epic, and so it'll be much smoother for patients, and they won't have to have any additional applications on their phone or their computer installed. So we're very excited to bring that level of ease and use. Additionally, like in the MyChart functionality, even that 98-year-old was able to complete some of her history and her review of systems in the computer, and the clinician can actually pull that information over into the note. So the patient, if they're calling about urinary tract system issues, they can put what time it started and this and that, and then that clinician sees their responses, pulls it over, and can ask them additional questions. So patients like being engaged like that in their medical record, and it really gives patients a lot of ownership over their medical record to ask questions and engage in their own well-being. If a patient's concerned that they might have COVID, they should call their primary care office. We have a fantastic nurse navigator program that can speak with that patient that day and go over their symptoms and see if they need a video visit that day with one of our providers or to go to urgent care. We can also arrange for testing if it seems like they need a test. We're trying to encourage people to do a video visit first just so we can have that personal assessment, because you can get so much information from a patient about their clinical status just by seeing them in person. So the nurse navigators, actually, if somebody does have COVID, we actually have a process where they call patients on day 1, day 4, and day 8 of their illness, and we provide video visits if anyone experiences any worsening. But we check in even if they're not calling us, we're checking in with them to make sure that they're safe at home and that they have what they need. Flu shots are incredibly important. This year we're going to take all of the flu clinics out of the outpatient clinics and probably put them in more of a drive-through scenario so that everyone stays safe and we don't have extra people walking into the clinics, and we can keep it at more of a socially distanced way. But flu shots are incredibly important, and I think this year you don't want to be sick with a fever and a cough and wonder, gosh, I didn't get the flu shot. Is this the flu or is this COVID? Both are lousy, but I think we know COVID is more contagious and has a higher complication rate. So I don't want anybody getting sick with either. And people die of flu every year as well. It's always an important vaccine to get. Any child over the age of 6 months should get a flu vaccine. Pneumonia vaccines are given in special circumstances. We give them to children routinely, and then to some kids and adults who have chronic medical conditions like immunosuppression or diabetes, asthma, chronic lung disease. And once you're 65, everybody gets a pneumonia vaccine regardless. So it's important to make sure that you're up to date on your vaccines and that you are practicing the social distancing and masking when you're out and about doing your errands. I worry a lot about my patients who have cancer, who are still receiving chemotherapy, who are immunosuppressed. I worry about my older patients and my younger patients with diabetes and chronic lung disease and who are on medications for immunosuppression. That means when your immune system's really low and you have a hard time fighting off illness. So for those patients, if they have a partner or a kid at home that can be the person who goes out and does the shopping and does it in a really safe way, and that person doesn't need to leave the house at all, that's my vote. And that's a person who I think, doing a video visit, if it's possible, is always a great idea, just to try to limit exposures as much as possible. It's been a really challenging time. I did have a woman in her 80s who told me she couldn't believe that she says, I've been waiting for a pandemic all my life because she was such an introvert. And she said that the introverts win, and she could do her quilting and she didn't have to socialize. She was very excited. But I would say the majority, the other 95%, have been, felt isolated, often at home with young kids, or not able to see their my elderly patients haven't been able to see their grandchildren or great-grandchildren with the same frequency or even at all. So I think people are calling up for emotional support. I think it's really important that we reach out to people. We do have a great behavioral health team. It's important to take care of yourself, to hydrate, to get out and walk, even if it's with your mask on, to take slow, deep breaths, to turn off the TV. I often write a prescription on a piece of paper that says news fast for 72 hours. And I think that often can be a very helpful way to help decrease anxiety. It's a good time to come up with a new hobby. Music, art, reading, all those things. Patients are calling and they're struggling, and we are here for them to call. And if they need to talk to somebody, they can see their primary care physician this week or their nurse practitioner, whoever it is that they have a connection with. Part of how we care for our community is by wearing a mask. So I understand that some folks, in the privacy of your own home, when you're social distancing, you don't have to have a mask on. But the moment you go out in public, you protect everybody else from you. It's not that you are protected from everybody else when you're wearing a mask. You actually take on the responsibility of protecting everybody from you, because 85% of folks who are diagnosed with COVID-19 have really no symptoms or just mild cold symptoms. Maybe they just lost their sense of smell or they're slightly congested, which really sounds like autumn in New Mexico. And so when you have those symptoms, 85% of those folks are really not going to necessarily know it's different than allergies or a cold. 10% of folks get sick, 5% of people end up in the intensive care unit. So our responsibility to each other as a community that cares, as the city different, as northern New Mexico, which I'm so proud to live in, is that we wear masks. We actually put signs on our clinic doors that say, if you choose to not wear a mask, we are happy to see you by a video visit, but you're not gonna be allowed in our clinic. And that's because we care about the people that we take care of. And I have a responsibility not only to all the patients that we care for in the outpatient clinics, but also for our employees and our staff and our nurses and our cafeteria workers and everybody who shows up every day to keep this building and community going. So you have to wear a mask. There's no choice. I think we're definitely going to be, doing this through 2021 and looking to see what comes up with a vaccine. We need to make sure a vaccine works, that it protects you against illness, and that it also creates herd immunity, which means if I have a flu vaccine, for example, that if I can't get the flu, I might help prevent a couple people around me from getting the flu. So it has that ripple effect on a community when some people start to get immunity and then other people can't get that same illness. But I think that the skills we've learned during this COVID-19 pandemic, if any other infectious disease is around the corner, we're gonna be so much smarter and wiser about how we care for each other as a community, because this is the time where even by masking and staying home and sitting on your couch and watching TV, we're taking care of each other as a community. That actual social distancing is a caring way to care for our community compassionately. I know never before would I think that social activism was sitting on your couch and watching Netflix, but perhaps now it is. So I think that, it's gonna be a tough road ahead, and it's not clear when it's all gonna be over, but I think if we band together, the amount of teamwork and camaraderie and collegiality and love and care from my patients and our colleagues here at CHRISTUS St. Vincent's has been so amazing in the last 6 months. It's really been phenomenal. I am so proud to be a leader and a clinician here in Santa Fe with this organization, because no one's kept anybody safer than we have.
Thankfully, our numbers of COVID-19 cases in children in Santa Fe have been relatively low. We are lucky that the low numbers of cases that we have had, the children do fairly well. Their symptoms are mild, and they recover quickly, usually after 1 to 2 weeks. Children and adults have been affected in all ways from COVID-19. These have been unprecedented times where we're spending a lot more time at home. The children aren't able to engage in their regular summer activities, summer camps, summer education programs. It's leading to a definite stress on the families and the parents. What we've been hearing a lot of recently, which has proven to be effective, is wearing masks, social distancing, and good hand washing. The masks have proven to be effective because if somebody has COVID-19 and if they're symptomatic, then hopefully they're going to stay at home. But family members that live with them could wear their mask. It could protect them from getting sick. For people who are asymptomatic and have COVID-19, whether they know it or not, wearing a mask is going to contain those airborne particles and droplets that they may be expelling when they sneeze or cough or even breathe. And so that's going to protect people around them and in general reduce our community spread. So wearing masks is definitely effective. The social distancing has proven to be effective as well. The thing is that we want to continue these practices. We want to continue to wear a mask, but remember to wash them after every use, wash them daily. I feel that that's a reminder that people need because we get stuck in our day-to-day wearing our masks and not washing them. So that defeats the purpose. We do know children learn best when they have in-person classroom teaching time from their teachers. We need to make sure that when we do send them back to school that it's in a safe environment and a safe way to prevent further spread of COVID-19. We will get there. I think we will get to that point where we know we can send our kids back to school safely. For the time being, school from home, in a supportive environment is going to be the safest thing for now. The CDC is currently recommending that children 2 years old and up should wear a cloth mask. There are some children with special needs or autism or other developmental disabilities that may not tolerate wearing a mask. There are also children with respiratory conditions that may not tolerate wearing a mask. We don't recommend mask wearing for children younger than 2 because it potentially could be a choking hazard or a strangulation hazard. Plus, toddlers in general have a hard time keeping their hands off of their face and off of their masks. It could defeat the purpose if they're constantly touching their mask, taking it on and off, leaving it on the floor, putting it back on their face. So in general, the older children are a little bit better about keeping their masks on, not using it as a strangulation device, and keeping their hands off of their face and off of their masks. Remote learning with your children can be challenging, especially if a parent is having to still work from home. I think it's about trying to assimilate as much of a normal school schedule and routine as possible. Having the child get up at a relatively normal time that they would get up if they were going to school, have breakfast, have a dedicated school or classroom type area in the house where the computer is set up, where there's no other TV distractions, games, and communicating with the child that, okay, this is going to be your area for school. When we're here, we're going to focus on schoolwork. And then giving the child breaks just like they would in a normal school setting, having time for recess, so getting them outside to run around and play, snack time, a dedicated lunch time every day. So a similar schedule to as if the child was actually attending school can help keep it a little bit more routine and the child will know what to expect. And then the same goes for after school hours. So after 3 p.m., if they're done with their schoolwork for the day, the child can run around, play, have a normal home experience without having to worry about schoolwork. And then that leads into the evening hours, which is, important for family time, dinner together, and then a normal bedtime routine, making sure the child's getting to bed at a reasonable time, turning off electronics an hour before bedtime. So really just trying to keep a routine so that the children know what to expect from a day-to-day basis. There's so much information out there every day, whether you have the TV on, the newspaper, I mean, it's a kind of a COVID-19 overload, and that can be stressful and confusing for children. I would encourage parents to turn off the news, maybe not allow their children to be on the TV, overhearing or seeing what's on the news 24/7, because it can lead to stress in children and stress in adults. I think that it's important to talk to your children about what's going on. Explain to them why they can't go back to school yet. Explain to them why they can't go have sleepovers with their friends. But again, not trying to give them too much information that can lead to more stress and more confusion for a child. Keeping the mood light and happy and trying to enjoy each other right now at home is key. So again, it depends a lot on the day-to-day routine and structure. Children do very well with consistency and consistent routines. So if it's that time of year when school's starting, like we talked about earlier, just having a consistent school schedule. But also that family time together, it's so important. Spend some one-on-one time with your children, even though that may seem silly because we're at home with our children so much right now. You still want to dedicate that one-on-one time. So if you have multiple children, carving out that time, you scheduling it, doesn't have to be long, even 10 minutes, that you say, okay, Peter, this is our one-on-one time together. What do you want to do? And that means a lot to a child. Also getting outdoors, having some sunlight, just getting some fresh air. We recommend 30 to 60 minutes of time outside every day. Of course, remember to put your sunscreen on, but just a little fresh air, again, incorporating that into the daily routine so your child can run around and burn off some steam does really lift those endorphins and help elevate the mood as well. A consistent bedtime routine, of course, is really important. I know that so many of us have been home for so long, from spring break, basically, we've been home. So we've had this extended summer vacation, and a lot of teenagers, a lot of kids are staying up way, way too late. So bringing back that bedtime to a more reasonable hour, turning off electronics an hour before bedtime, the whole bedtime routine. If you have younger children, giving them a bath, reading to them before bed is so important. Distinguishing the symptoms of COVID-19 in a child versus other common colds versus allergies can be tricky. One of the symptoms that'll be pretty consistent in children as it is in adults is fever. So they're usually having a fever. A lot of children do present with some type of cough or shortness of breath as well. So that is also very similar to adults. There are multiple other symptoms that children can present with COVID-19 as well. Anything from diarrhea and vomiting, so some stomach complaints. They can get headache, dizziness. They can also get that loss of smell or loss of taste, which an older child may be able to describe, sometimes sore throat. So the symptoms can often resemble many other common viruses, but I think it's the persistence of the fever, the cough, and the shortness of breath that you'd want to monitor for. If your child is showing any symptoms that are consistent with COVID-19, the best thing to do is call your primary care provider's office. They can help you walk through the symptoms, determine if it's something where your child should be tested for COVID-19 or something that you should maybe isolate and self-quarantine at home. Arroyo Chamizo is open for business. We have been continuing to see patients. We always have newborns that need to be seen, babies that need to be seen, so we are open. Our clinic is following standard guidelines, and we are screening everybody that comes in. So you can expect to get 1 or 2 calls even before your appointment asking if you've had any symptoms of COVID-19, if you've had any travel, if you've had any exposure to anybody that you know with COVID-19. So you will get a couple calls reviewing those type of guidelines. When you arrive to the clinic, you will get your temperature checked. We will ask you to wait in the car until an exam room is ready for you, and you will be called then and brought in directly to an exam room. So there's no time waiting in a waiting room. Again, just to allow for that social distancing and to keep everybody safe. We are seeing all children from newborns to 18 for their well child checks and for other more acute care visits. We are also doing video visits, which is convenient for parents that either don't want to come into the clinic, or if a child is sick, it may be a safer scenario to do a video visit and determine if they do need to be seen or not. Our well child checks are crucially important to continue, especially for infants that need vaccines. The last thing we want is for a child to get delayed on their vaccines, and then we have another epidemic on our hands. So it is important to bring your child in, keep up with their annual well checks for the older ones, and their infant well checks for the young ones, and any required vaccines. I believe our hospital here, CHRISTUS St. Vincent, has done a wonderful job. We had a center set up called the CCAT, which was offering testing for individuals in their car, basically, to limit contact and limit exposure. The CCAT was very effective for testing and for seeing and screening individuals that had respiratory symptoms or symptoms of COVID-19. I believe that our clinics, our outpatient clinics, and the hospital have done a really good job in keeping visitors and patients and staff and providers all very safe by our screening measures that we've taken, checking everybody's temperatures, screening all employees before they come into their place of work to make sure that everybody is healthy and that nobody's had any risk of exposure and not showing any symptoms of COVID-19. COVID-19 is still active in the world and in our community. We still need to practice social distancing. We need to wash our hands. We need to wear our masks to keep us all safe and healthy. But at the end of the day, try to enjoy this new life as normal. Try to enjoy your time with your kids. Make this schooling from home a new positive experience for you and your families, and we'll continue to all get through this together.
Thank you for joining us today. We are so happy to share with you a little bit more about what we are doing to care for our COVID-19 population and our general patient population. If you have any questions whatsoever, please reach out to us on our Facebook page or on our website. Be safe and be well, take care of you and your families, and be sure to always do those things that keep us safe. Wear your mask, honor social distancing, and wash your hands again and again and again. Thank you again. Be well.